Do you know who can give us these answers and help us? Are the people in the sector, the healthcare sector. They're the experts, and I really rely on them in Ontario, and I know my colleagues rely on them as well.
And here is one of those experts. Dr. Alika Lafontaine is the newly elected president of the Canadian Medical Association. He's the first Indigenous president in CMA history, and he's with us from Toronto. Hi, Dr. Lafontaine. Good to have you back on our program.
Thanks for having me.
And congratulations on assuming the new role. I do appreciate you making time so early on in your mandate. I wanted to start off by asking you about something we just heard from the Atlantic premiers who are meeting with Ontario's premier on the subject of healthcare. They all kind of asserted in concert that the status quo right now is not working. Would you agree with that sentiment?
I'd say absolutely. I think the question is how you define the status quo. When you look at it from a patient or provider perspective, the status quo has really been this almost obsession towards cost cutting as a solution to our health sustainability problems. There's so much more that we can do and so much more we can focus on. So I agree 100% that the status quo is no longer an option in health.
So in layman's terms, I'm going to ask you if I'm interpreting what you just said correctly, and then you can tell me and hopefully explain to our audience. When you say obsession over cost cutting, do you mean that provinces in general have been cutting costs to the detriment of service delivery or of the experience for the patient or the provider? And what evidence do you have of that?
Well, I think if you look back to any type of news releases that governments have come out, whenever it talks about cost cutting, there's always this connotation that it's inherently something good, right? Cost cutting is a good thing for the system. When in reality, we know that we can cost cut things like our budget to the point where eventually we don't have enough food to eat, we can't keep our heat on, other things that we need to live. And that's really what's happened within healthcare right now. And the acceleration of those cost cutting effects has gotten worse over the past few years because of the increased acute demand. You know, the pandemic obviously led to greater demand on the healthcare system, as has the reality that patients now are much more sick because of backlogs and lack of access to care. And so absolutely, you can get to a point where you can cost cut below that threshold where things remain sustainable. And we're definitely there across the country.
My guess would be the premiers would respond and say their budgets have in fact increased year over year when it comes to healthcare. So when you say cost cutting, specifically, what do you mean?
So if you go in as a patient to the healthcare system, you can see firsthand where these impacts of cost cutting have occurred. You know, nurses are now required to see many more patients than they were required to, back in the day. This is one of the reasons why burnout is so high in that profession. Physicians are required to do more and more with less and less. The resources that we have to call on when we're within the healthcare system, they're just not the same as they were years ago. Demand is higher. The outlay of costs might be a bit increased when you look at absolute dollars, but when you're looking at that frontline care, the time that we have to spend with patients, the time that we have to connect with patients, that's gotten shorter and shorter. And it's not just cost cutting, but it's also, making sure that we get as many patients through the door as possible. And in the end, you get to a point where that's just not good care.
And so does the kind of what we should gather from that, is it that an injection of money is going to help things or improve the system, or is it, as the premiers would assert, bigger than that, not about money, but about changing the way things are done? Where do you kind of sit in that?
When I talk about the status quo, you have to start first with the priorities that premiers have. The priority of the system has always been cost cutting and patient volume over the last decade. That's very clear to anyone who sits back and goes through news releases and different actions to try and find efficiency within the system. We've gone way too far with that. Now, when we reprioritize things, we can reprioritize towards more time with patients, ensuring that we have higher quality care, addressing patient safety concerns, addressing working environments and the burnout that results as a result of the high stress that happens in those high efficiency environments where you just don't have the resources that you need. Once you get those priorities straightened out, then you can start to look at whether or not your problems match your solution. But if you start off with cost cutting and patient volume as your priorities, then there really is only a small number of options that you can do. And those will not lead us to the direction that I think we want to go, which is sustainable, equitable healthcare system.
And so, again, when you emphasize the idea that all premiers begin with the idea of cost cutting, today in their press conference that certainly didn't seem to be the message. They were, though, however, all of them kind of leaving open the door to more private delivery through public means or public money of certain things, like the example of last week in Ontario and pursuing surgery. I know that the CMA has come out, critical of that in the past. Are you aligned with your predecessor on that? And again, do you have evidence that it's not going to work? If so?
I think the idea of privatization often is two ideas mixed together. The first is what we often hear from governments, that we have a strong public system that's supported by private support. The second is really outsourcing. And when we're talking about privatization in this environment where the healthcare system that's public is very unstable, outsourcing is really all we can do in this environment. Physicians are concerned about outsourcing because it leads to increased fragmented care. Once you push that capacity out of the system, that capacity is not returning easily. And that will lead to longer wait times. That will lead to less oversight and just generally a worse experience for both patients and providers. What we advocate for here at the Canadian Medical Association is an equitable, fully supported healthcare system that is focused on the right types of priorities. And I think that carries on the work of Dr. Smart and previous presidents at the CMA.
If it's pushing capacity out of the system, but you've just described a system that from the provider perspective is already beyond capacity, why is that inherently a problem? And I take your point about being worried about outcomes, and I've certainly put that to the minister here in Ontario, where long-term care is concerned, even just as one example. But if the capacity is already stretched, and this helps with that, why is it such a bad thing?
So I think the presumption is that it will help. So that's I think the first kind of logical fallacy that falls into this.
How can
the
you
second,
presume
once
the
again,
opposite, though, with respect?
Well, there's just not enough of us to go around. For example, we are bringing in anesthesiologists from different parts of the country in order to, provide surgical services elsewhere. There's a set number of persons who can actually provide that type of service. There's a set number of people who provide primary care within the community. And so you're really just moving people from one system to another. When we talk about a fully supported, stable public healthcare system, that's a healthcare system that has resiliency when there's demands on it. It's the experience of showing up to your care as a patient and having confidence that you'll see someone on time or in a reasonable amount of time, and that when they do see you, they'll see you and take time to actually provide you the care that you have. In the absence of those things and other flags, we can move forward with privatization, but it will not fix those problems. We have to address the support of the public healthcare system and make sure that we get it to be a sustainable point before we start to look at these other options as our primary solution.
And just before I let you go, Doctor, I certainly take your point where, it's kind of like moving bodies, like you only have a finite number of people staffing. And we know actually from the experience of so many provinces right now, understaffing is already a huge concern. Where doctors specifically are involved in this, I've heard now from many provinces this desire to speed up or make more accessible the accreditation process for internationally trained doctors. I know that doctors, for example, colleges of physicians and surgeons, play a huge role in that, and in the past, in certain instances, have not been as amenable. Do you think that, from your perspective as the head of the CMA, that is going to change? Would that be a good thing from your perspective?
Anytime that decision makers say that the status quo is not an option is an enormous opportunity to change our priorities and also the solutions that we apply. There was another quote that really stood out to me, and that was that all options are on the table. And if all options are on the table, let's remove all barriers. So mobility of healthcare workers across the country is a barrier to making sure that we have a comprehensive plan for health human resources and make sure that we have that sustainable system that provides equity and the other things that we expect from our Canadian healthcare. I think if all options are on the table, we have to discuss removing those barriers, just like you said.
Dr. Lafontaine, thank you very much for your time. And once again, congratulations on your new position.
Thank you.
Appreciate it. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.